Your next challenge is going to be taking vital signs. You are used to taking the blood pressure, the pulse, the respiratory rate, and the temperature very quickly on an adult. Well, you can't do that for a child. So like I mentioned earlier, if the child is quiet or sleeping, you want to take that heart rate for 1 full minute. You want to take the respiratory rate for 1 full minute. Do not leave your stethoscope and the chest until you have the heart rate and the respiratory rate. Why do I say this? Because I'll watch a student stand there for 2 minutes and they'll look up at me and say, okay, the heart rate is 90. And I say, what was the respiratory rate? Oh, I didn't get that yet. And by now the kid's crying. Taking it for a full minute is going to be a challenge, especially for the younger child. We're going to practice this in Skills Lab where I'm going to make the heart rate go up very quickly. A normal newborn heart rate is between 120 and 160. Their respiratory rate is between 40 and 60. You are not used to listening to that and counting, and it's going to take you a lot of practice. Once you get it down quite well, you can cut it in half and do the heart rate for 30 seconds and the respiratory rate for 30 seconds. But don't do that until you really know what you're doing. Another thing we're going to practice in Skills Lab is taking the blood pressure. And one thing I want you to do prior to going to Skills Lab is reviewing your anatomy. Where do we put the blood pressure cuff? And what artery are we using to measure the blood pressure? Because I am going to ask you this. So we can put the blood pressure cuff on the arm, on the lower leg. Occasionally we'll put it on the thigh. You have to make sure that we have the right size blood pressure cuff. And once again, in Skills Lab, we have the whole gamut of what is available to us. So here are some helpful hints. Choose the arm to take the blood pressure and the temperature. Make it be the same. It's okay for you to pick up the baby or the toddler and go ahead and put the blood pressure cuff on, put the thermometer underneath the axilla, and then start rocking and singing and hit the button to start. And this baby is going to be looking at you like, oh, I'm kind of liking the song and I'm kind of liking the movement, but I'm not sure about what's going on with my arm or my leg. By the time they figure out what's going on, you're done. Have the child hold either your watch or your stethoscope or grab something that's a toy in their bed. You can do medical play while doing vital signs with the doll or a stuffed animal. Now granted, it's going to take you longer to accomplish your task, but it can be done. For the older child, your late toddler, your preschooler, and your school-age child, just tell them that the cuff is going on their arm or their leg and it's going to give it a hug. You're going to feel it squeeze, but it's going to be a hug for the extremity. And then if you cannot get it, do not be in there for 10 minutes. If you can't get it, ask for help. The parents can hold the child during vital sign taking. Another nurse can come in and your clinical instructor is available. When we think about doing a physical examination, you want to do the most invasive or painful last. When you're in an outpatient setting, you're going to see that we take the measurements, the vital signs, and then we're going to take them in to get their hearing and vision screen. Now, these are not tests that hurt them. Some of the hearing and vision screening is actually quite fun. So we'll get that out of the way. When you watch the pediatrician or the nurse practitioner do the exam, as soon as they go for the ears or they put that stick in the mouth, all bets are off. That kid is crying and they're not going to be very cooperative. So you're going to see that the sequence is quite different based on the cooperativeness, the developmental level of the child. As you're getting vital signs, as you're helping the parent to get the child undressed, start assessing the baby's skin. You don't have to just sit there and say, okay, I'm going to be looking at the skin. Use your eyes and examine this child while you're doing other things. Listen to the heart, listen to the lungs. We check the belly, we do musculoskeletal. And you know what? If they're ambulatory or whatever they're doing while you're trying to get their vital signs, height, and weight, you can be assessing their musculoskeletal and their neurostatus. Is the baby crawling? Is the baby walking? Does the baby have a funny limp? Does the child have a limp? Does it look like their back is straight? Are they as strong as you would expect them to be? Are they alert? Are they oriented? Can they handle their own secretions? These are some things you need to get used to watching and multitasking while you're doing an assessment. So what we're going to do next is talk about what you're supposed to be looking for that's going to be a little different from an adult, what equipment you're going to need, and how you're going to go about it.